All right, good morning, boys and girls. It is December the 6th. East Coast here, man. I'm in Atlanta. It's about 9:40 almost. And today we're going to have a quick, maybe like 20, 30 minute Q&A session on testosterone, peptides, semaglutide, weight loss, whatever it might be in the health and wellness world, more on the medically managed and pharmaceutical side. So, we're here to help you guys in whatever endeavor we can when it comes to that. One of the things I'm going to start off with, and I always record these so I can put them back on YouTube later. So if you want to watch the whole thing, man, feel free. One of the things we're going to start with is fertility. It is a known thing that research completely supports this. Man, we're losing like 1% of fertility a year. It's crazy. The average 30-year-old right now in 2023 has about 50% of the testosterone and about 40% of the fertility that his granddad did when he was 30, so 50 years ago. And so it's terrifying, right? It's literally an extinction event, man. We've dropped fertility by 62% in 50 years. We've dropped testosterone by 50% in 50 years. And in that regard, it can't happen again, right? You can't lose another 62% of fertility. Like, we're dead. We're extinct as a species. We're pretty resourceful as a species, and there's enough stuff to worry about, right? Like global warming, pretty scary for a lot of people. All these, these potential nuclear wars going around all around us. That stuff's scary, but we're resourceful, man. As a people, we'll figure that out. But man, if we can't procreate, like, what do we do? That's going to be terrifying. So one of the things that we have recently done is we have partnered with a company, and we have a lot more information coming out about this, but the company's name is called Give Legacy. And for $300, you can send in a sample, and they will do they'll give you back your semen analysis, and they freeze it for something like 14 days to allow you to do whatever you feel is appropriate. So they're also a cryopreservation facility, and it's a big deal, man, because we get so many guys. They're like 33, 34. They're like, yeah, I should be great, right? For whatever reason, man. No, the average 30-year-old's not great anymore. So this company, Give Legacy, man, for $300, you send in a sample. They'll freeze it. They'll show you the results. And then if you're like, hey, I'm great, just throw it away. No big deal. But if you are compromised at that fertility level, they'll hold on to that, right? In a cryopreservation facility that they have, and it'll be there when you need it, and obviously that costs more than the $300, but it's not expensive. It's amazing. It's amazing how affordable this service is these days. And so if that's something that you guys are interested in, by all means, please let us know. We're going to have a whole website or a whole web page on our site devoted to this service, and I can't wait to offer it because it's such a godsend. So many young guys have almost no testosterone right now. It's absolutely crazy, man. I mean, we run a testosterone replacement company, right? Like, this is all we do. And you would think our average patient would be like in the 50s or something like that. Our average patient is in the 30s. It's like 36, 37 years old, which means if our average is there, we have a boatload of guys in their late 20s and early 30s on the program. And we're not one of these clinics you can just walk in and get a shot. You know what I mean? We don't play like that. Like, you have to medically qualify to be on our program, and you have to do that with two different factors. One, blood work, obviously, but another one is symptomatically. You have to have some sort of a symptom that we're going to treat. Otherwise, it's just bad medicine. And the FDA is very clear that you can't use, testosterone in any kind of anti-aging or performance-enhancing manner, or it's bad medicine, right? So we don't do bad medicine. So with that being said, all of these guys coming in that are in their 20s and super early 30s and their testosterone levels are like 200 or something along those lines. Where there's smoke, there's fire a lot of times. And we can already tell, hey, they're compromised at the testicular level when it comes to testosterone production. Well, there's a real good chance they're compromised at that testicular level when it comes to fertility as well. And partnering with this company called Give Legacy is going to really help us offer an additional service that's just life-changing for some of these guys. So if you guys are interested in that, man, shoot us a text or an email, hit us up on here, and we'll get you going. So I got a question by Fly Guy Rye, and this is the most popular question we get. And he says specifically, what's a low level for a 38-year-old male? We get that across the board, right? And so what's low, and I hate to give an ambiguous answer, right? So what I'm about to say is not me deflecting, right? But the honest answer is, it depends on you. And the numbers that we go off of are the free T numbers, you know, and so most guys need to be somewhere between 20 and 30 to feel optimal. Now, some guys walk around at 15 naturally and they feel like Superman, and that's great. And if that's the case, right, like I said earlier, we need a symptom to treat. If they feel great, we're not touching them, you know, but if you're at 15 and you feel like crap, then yeah, we're going to touch you. And we keep guys in that 20 to 30 range on the free T scale. It's going to equate to something like an 800 to 1100 on the total range. If most guys, you know, if you convert the right way. So somewhere between like 800 and 11 is where you need to be, but we specifically shoot for 20 to 30 on the free T scale. And that's the right number for most, right? Again, there's so many outliers, there's so many variables. We have to custom curate the plan to you and put you on the amount of testosterone we think is right. But then where we really get it right is we listen, right? You come back in 8 weeks and we're like, bro, how do you feel, right? How's your energy? How's your erections? How's your libido? Are you burning a little bit more fat yet? Are you gaining muscle? Did you get some results in the gym? Are you recovering better? Any mental, you know, cloudiness, is it starting to resolve? And if that's the case, then you're probably in the right spot. So again, I danced around that answer a little bit, but that honestly is the right answer. The next answer is thoughts on clomiphene and anastrozole. So enclomiphene and enclomiphene are two different things. One's called clomiphene. That's old school. It's a fertility drug. And what it does, it sits on estrogen receptors in your brain, and it tricks your brain into thinking there's no estrogen in your system at all. And in the male body, estrogen primarily comes from testosterone. So the body goes indirectly says, oh my God, I must be out of testosterone. So it ramps up natural production. Okay, so that a lot depends on whether that's going to be successful. Number one is, do you have the testicular potential to even make anything anyway, right? So if I fire up the system and I'm pushing the pedal on the car, I still need an engine, right? I still need gas in the car to make it work. So clomiphene ramps that cycle up. It's awesome for some guys. It has a super long half-life, and it does starve certain tissues from estrogen. And so we don't love it. We do use it for family planning because that's so important. But for guys that are just on testosterone, who we want to protect their testicular function, we use something called N-clomiphene citrate. It's weak. It doesn't do a ton, but it does give enough stimulation to your testicles a couple times a week to keep that tissue from atrophying. And that atrophy causes long-term cellular damage over time. We don't want that. So we're big on that. Every patient is on something, whether it's HCG, HMG. Some guys prefer gonadorelin. I don't love it. Some guys are on enclomiphene, but everybody's on something to take care of their testicular health. And that's a mandate of our program, because our practitioners, I mean, man, they took an oath to do no harm. And we know if we give you testosterone by itself, we're killing your testicular function slowly, right? And it's not going to be in 6 months or a year, but we are causing damage, and we don't want to do that. All right. So the second part of that question is, what about anastrozole? It's right for the occasional patient. Okay. And so what I mean by that is, some guys grossly overproduce testosterone into estrogen, right? For those patients, we need something to slow it down. Okay, most guys, they don't need anastrozole, right? Anastrozole is an estrogen blocker. It's called an aromatase inhibitor. Aromatase is the enzyme in the body that grabs testosterone and turns it into estrogen, because we don't make much outright with our testicles, right? Women have ovaries. They make a lot of estrogen with their ovaries, so we don't have that function. So we have to do it enzymatically through that aromatase process. And because of that, again, mostly obese guys, because the aromatase enzyme is found more heavily in adipose tissue than any other tissue in the body. So the more fat you have, the more aromatase you have, therefore the higher that conversion rate is going to be. But most guys can carry a boatload of estrogen and not have any problems with it. So our philosophy is like, I want you to carry as much as you can have until you start developing symptoms. And what are the symptoms of estrogen? It's literally PMS. PMS for women is just a physiologic response to elevated estrogen levels. That's all it is. And it's like water retention, emotional issues, tender nipples, you know, there's more on the female side, but that's what it is for guys. They're like, man, I'm so emotional right now. I'm retaining water. My nipples are killing me. Like, you know, I got sensitive breast tissue. That's way too much estrogen to the point that the guy's developing symptoms, right, or side effects. And so these side effects can get pretty bad. And so that's where we intervene with the anastrozole. And so again, most guys don't have it, maybe 1 out of 6, 1 out of 7, 1 out of 8. But the guys that are on it need it. We don't hand it to guys for no reason. All right. So hope that answers your question. Let me get back to the next question. What are some other treatment options than HCG, testosterone, or enclomiphene? Well, it depends on what we're treating, right? For testosterone production, there's really nothing that works, man. No boosters. I mean, you can look, there's some ashwagandha products and this and that that have like very, very marginal boosts, right? But it's not anything therapeutic enough to be clinical as far as a clinically responsible alternative. So if you need testosterone, unfortunately, you need testosterone. If you get on testosterone, you need something to protect your testicular function. HCG is phenomenal. Clomid short term is phenomenal. And clomiphene, we love it. HMG, fantastic. HMG is human menstrual gonadotropin. It is literally FSH and LH pulled out of menstrual period material, typically in China. They literally take women's period material and they pull these hormones out. That's delicious, right? But yeah, man, these are the primary ones, man. There's a reason why those products are primarily used by almost all TRT clinics, even fertility clinics, obviously not testosterone, but they're just the best, right? And so we go with the best. All right, Cade, he's on 200 milligrams of test. Is it better to do it 1 shot or 2? 2 is the sweet spot, in my opinion. Testosterone has a 7-day, cypionate has a 7-day half-life, and enanthate roughly the same. So you can basically say they have a 7-day half-life. So if you get up to 1,000 on Monday, if you don't take 2 shots a week, if you're just doing 1 a week, that means by the next Monday, you're at 500, right? And that's a hell of a seesaw, right? You're going back and forth and back and forth. You can feel the difference between 1,000 and 500. Right? But if you're doing 2 shots a week, you're probably going from 900 to 700, something like that. You're not going to feel that rise and fall as much. And don't forget, the average 25-year-old, they can sway 300 to 400 points naturally if they, go out, they booze it up in a weekend, they run a little too hard, they're too stressed or whatever, and then all of a sudden they start taking care of themselves. That can be a 300-400 point swing just in a matter of a couple of days. So our bodies are used to that kind of homeostatic swing, or a little bit of a rebound. We want to minimize that rebound as much, and I do think 7 days is too much. So we tell all of our patients to get on like a Monday-Thursday rotation, take half your dose on Monday, half on Thursday, and it just makes it so much easier. You're a lot more stable and steady when you do that. All right. After 45 years of testosterone, I stopped HRT 4 months ago. Normally, that's the opposite. Normally, at about 45, everybody's getting on it. Question, Orchard, if it's proper for you to share. Why did you quit? I'm curious. All right. Oh, had a cryptorchidism as a boy. Yep. He's dealing with a little bit of different issues. Gregory, 40-year-old, had labs twice, fasted morning was 706, but lunchtime test was 278. That drop. That's a serious drop. This is one thing I hate, the insurance-driven requirement for morning lab work. Right? Because like you just said, Gregory's a great example of this situation. I get our clinics out of the idea that they need a morning read, right? That's an insurance-based requirement because insurance is trying to get you at your highest level so they can say no. That's the only reason that is there, right? My biggest concern is if you feel like ass at 2 o'clock in the afternoon and you can't figure out why, get your test done at 2 in the afternoon. That way we can treat that. That's why you're interested in a solution, right? The 2 o'clock problem, not your 8 o'clock problem. So get the lab work, guys, when you feel bad, right? If that's afternoon or like early evening, go as late as you can to LabCorp. That's going to be a read on the appropriate issue that you're looking for the solution, right? And if your doctor tells you, hey, man, I just want the morning read, tell them, say, dude, I feel fine in the morning. I feel like shit in the afternoon. So they should be able to listen to that. So nandrolone and enclomiphene is safe and better than test. Nandrolone is pretty safe, right? As far as an anabolic goes, it's very safe. It doesn't aromatase heavily. it's a pretty good, clean, in regular doses. It definitely has side effects in the bedroom at higher doses. Enclomiphene, I do think is super safe, right? There's some research coming out. We're actually part of a research study right now that we're looking at sperm efficacy with enclomiphene. I can't wait till these results come out to show you guys. It's amazing. But yeah, man, we don't prescribe nandrolone, but if you're going to pick an antibiotic to use, I don't mind that one at all. So it says it says you're licensed, but not what you're licensed in. Okay, great point. Our medical director, whether we have a doctor, we have 2 nurse practitioners, they have license to practice through medical boards in certain states. So I think at this point we're licensed in like 8 or 9 states. They have a license to practice medicine in those states. So that's what that means. I'm personally not a doctor. I'm an educator in the space. I've taught hundreds and hundreds of doctors how to do hormone replacement. But I just know this vertical, man. This is my sweet spot. You get me outside of this, I have no idea what I'm doing. And so y'all keep that in mind. Anything I tell you guys today is not medical advice either. I'm not a licensed medical provider. I don't give medical advice. I'm just talking about the products and kind of what they do and, kind of trends in the industry and what a lot of people do in certain situations, but I'm never telling any of you guys exactly what to do. I promise you that. All right. Keep Kev Tunes currently on a meal of 200 every 2 weeks. Is that enough? No. All right. Let's do the math on this, right? 200 milligrams every 2 weeks, and he's on Cypionate. So I said that the Cypionate has a 7-day half-life. So if he gets himself, near the end of the month, he takes a big shot. So on the first day of the month, if he's at 1,000, on the 7th, he's at 500. On the 14th, when it's time to inject again, he's at 250, right? That is one hell of a trajectory, up and down and up and down. And on those lower levels, that's not enough anabolic support to maintain and build good muscle, right? So some guys, 100 milligrams a week is enough. It depends on you. That might be a good dose. But if that's the case, I would rather you be taking 50 milligrams twice a week over those 2 weeks than 200 once. It's just a hell of a, if you take 50 milligrams, you're just going to do this nice and steady. That 200, man, on a 14-day cycle is just a yo-yo. So hope that helps. All right. Top 3 side effects to look out for. Very cool. Number 1 is the one that we're concerned the most with is hematocrit. So what hematocrit is it's a red blood marker, and it is the percentage of your total blood volume that is comprised of actual red blood cells, okay? And so we watch that number because testosterone, it stimulates the kidneys to release something called erythropoietin, right? Erythropoietin stimulates bone marrow to make red blood cells. If you guys remember when Lance Armstrong got busted, he didn't get busted for running a bunch of like crazy, anabolics or anything like that. He got busted for running something called synthetic erythropoietin, which makes his body make more red blood cells. It's blood doping, right? And so what happens when this number gets way too high, about 58, 59, 60. So when you get roughly like 60% of your blood is totally comprised of red blood cells, it thickens a little bit, right? The viscosity increases, and at that capillary matrix, right, where all the arteries are returning back to veins, it gets incredibly tiny, right? Some capillaries are only big enough to allow like one red blood cell at a time through it, right? So the traffic backs up, and that traffic backing up can cause hypertension. So we don't want to watch that. We don't want to be a part of that, right? So we always watch the hematocrit level. When it gets a little bit high on some guys, most guys are fine, right? But some guys need to fix this. The beauty of this is if you're that guy, right, your traffic's starting to back up and that hematocrit number is getting high, if you give blood, it drops that hematocrit, So you get up to like a 54 or 55, boom, you'll be back to a 51, 52, a much more reasonable range. So that's the number 1 side effect that we're looking for. Number 2 side effects, I'm going to group them into families because downstream from testosterone, there's only 2 hormones, right? There's estrogen and there's DHT. Estrogen, like we said earlier, can cause gynecomastia, it can cause water retention and emotional issues pretty bad, right? So anything in that regard, we're looking in the estrogen treatment area for that. Well, on the DHT side, it's called dihydrotestosterone. There's an enzyme called 5-alpha reductase. It grabs testosterone, turns it into DHT. DHT is a male pattern balding hormone. It is a prostate issue. It causes BPH, like benign prostatic hypertrophy, which is an enlarged prostate, and it can cause acne really bad as well. So if we see acne, BPH, and anything in male pattern balding, we're going to start trying to treat it in that regard. We have systems in place to do all of this stuff. Any good TRT clinic should tell you how they're going to do that, right? So we can use things like minoxidil, finasteride, tretinoin for hair issues. We can use Flomax or finasteride, low dose finasteride, by the way, too. We're never doing those 5 milligram doses under any circumstance, but we have protocols to treat each one of these issues that pop up. So Jay, great question. If anybody says, oh, there's no potential side effects with testosterone, run like the wind, please. All right. Also taking stuff in that decanter. Yes. That's the good stuff right there for sure. All right. Why does husband need to give blood while taking anastrozole? Okay. Jenny, good question. It's not the anastrozole, though. It's the testosterone causing the problem, but it's hematocrit's getting up there, and that's one of the issues. We just talked about that. All right. Jenny, do you believe the foods we're given is the cause of the decrease in today's testosterone levels for men? That's a beautiful question. And the answer is I have no idea. Research has several times tried to identify like single data points, right, to cause or to show like causation in this area, and they can't. I think it's a lot of things. Our food sucks. Even if you eat healthy, right? The healthy food out there doesn't have the nutritional content that it did 20 years ago because the soil is so monocropped, it's depleted like crazy, right? So our food quality sucks. Our environmental toxicity is through the roof, right? Just all of the cleaners and the air fresheners and everything you touch has microtoxins and microplastics and all of these things in there. I think that adds up. Little boys spend more time on their tablets than they do outside. I think that's a big deal. And also little boys, this is a bit of a social thing. They're not allowed to like go out and tackle each other and just play in the dirt. Like little boys are clean and they're told to be like, proper and prim and keep your right angles and this and that. I don't think that's necessarily great, for these kids. Also underwear. I mean, we have a scrotum for a reason, right? Our testicles are supposed to stay away from our body. In order for the temperature, right? Our testicles need to be a little bit cooler than the rest of our body. And now with all these compression shorts that everybody's wearing, is keeping our testicles at 98 degrees. That's not good for us, right? So I think it's just a whole bunch of stuff. There are boys graduating high school right now that never had recess one day of their life. That's not good, right? And if your parents don't happen to be active and get you outside, some of these kids don't see daylight, right? For like hardly at all. They see daylight going from their house to the bus and their bus to the house. And that's it. That's not good either. So it's environmental, it's social, it's definitely the food, it's the toxins, it's all kind of stuff. So that's my way of saying I don't know. All right. Anything over the counter to help with hematocrit levels? No. You got to give blood or reduce the testosterone. Right? You can do that. I don't like reducing testosterone because we should keep the testosterone at an optimal level, and again, it's not just like boners and muscles, right? It's your brain, it's your heart, it's your bones, it's your overall metabolism, it's your waistline. And when your waistline starts to get out of control, everything starts to get out of control, right? I mean, that is your waistline is your single largest morbidity indicator, right? The fatter your waistline, the more likely you are to die early and terribly. Period, right? That's inarguable in science when you evaluate like comorbid conditions. So whatever we can do to keep all of those things under control, we want to. Optimal testosterone is one of the primary ways to do that. So I don't want to dial testosterone down when we can just go give blood once every few months. And man, when you give blood, you might save somebody's life, right? So we should be giving blood anyway, if you ask me. Gentleman Jack, do I need HCG? I'm 44 and I've had a vasectomy. That is a wonderful question. We do hear that all the time. Obviously, you don't need it for fertility, right? But 44, you're on that you're pretty sure you're not going to need it. We get this question from 34-year-olds, and when I get that question from a 34-year-old, I'm like, you may be in a very, very different position when you're 40. God forbid. But again, when you've seen thousands and thousands and thousands of cases like we've had so many guys go, man, I got 2 kids. I'm 34. I'm as happy as I can be. I've got a vasectomy. I don't want to take anything to take care of my testicular function. I don't need them. Well, then at 40, he's divorced, unfortunately it happens, right? Married to someone new, she's younger, she wants a kid, and he didn't take care of his fertility, and now he's in trouble, right? Even if you have a vasectomy, you can still have kids later, right? It just takes an extraction. You have to go in and get it. We want to take care of that. And also for you, Jack, at 44, downstream from testosterone, hormonally, there's a cascade of other things that are happening. DHEA, progesterone, and pregnenolone are 3 hormones that when you depress LH production completely, they depress as well. And for a lot of guys, when you increase those, they feel so much better. That's why so many guys say, man, I started the HCG and I feel so much better. It's not necessarily the testosterone boost from the HCG, because you should have been on enough testosterone to begin with. It's those other hormones impacting you. And so for some guys, man, it's a big deal, and so it depends. No, I am not a doctor. I'm an educator in this space. All right. Really good question here, man. Someone says, but what if those other treatment options aren't working and all other tests have been completed? I would venture to say not all other tests have been completed. We run into this issue. Some guys will come to us. We get their testosterone level where we think, they should be great, right? Their estrogen looks great. Nothing's out of control. All their primary overall health markers look good. There's no smoking gun. And they're like, man, I feel like crap. So then we start looking into lifestyle. Are you smoking weed? Terrible for your overall being, right? Not to start a fight. I know a lot of people love it. But as far as your overall optimal state of being, weed depresses the hell out of that for most guys, maybe not for all. Are you on an SSRI, right? Incredibly depressive as far as feeling optimal. You don't feel depressed, right? You don't feel anything. You feel numb, and that's not what we need either. So for some people, an SSRI is exactly what they don't need, but also we get into micronutrient testing, we get into gut testing, we get into some other things. There's sleep analyses that can be done. You got to look at all these other systems. We start with testosterone because so many times testosterone is just the easiest and the shortest pathway to feeling amazing, right? Helps you start losing weight. When you lose weight, all your other biomarkers improve, your A1C gets better, like everything starts to improve. That will affect long-term health. But if it doesn't, we have additional options and we evaluate that patient individually, start trying these other things. And sometimes we'll say, hey, your gut is wrecked, right? Or, hey, you absolutely have no, several of these micronutrients that you need. We need to put you on some kind of supplementation, and bam, they're back, So there's a lot of things it can be, and other times it can be mold, it can be fungus, it can be, toxin issues. And those things get expensive. A lot of clinics like to make a ton of money on people up front by running these super expensive diagnostics on them. I think that's highly shitty, right? We would never do that unless our patient needs it, right? And a lot of patients are just curious. They're like, hey, can I run a gut test and a mold test and do this and that? They're like, I want to know. And I'm like, well, that's like $4,000. Do you want to do it? And most people go, nah, I was just curious. But a lot of people go, yeah, and if $4,000 isn't anything to that man or woman, of course we'll do it, right? We want to serve them. But we're sure as hell not going to lead with that by going, well, we want to make sure that, like something's not going on in the background that'll impede your progress. Well, if it is, we'll find it eventually. And I'm not going to charge you 10 grand up front to do that. And so good question, man. Is a low dose AI dangerous for cardiovascular system? No. Not necessarily. What's dangerous from a cardiovascular system is incredibly low estrogen levels. Now, AIs reduce estrogen, right? So people correlate that. They go, oh, well, AI is going to reduce estrogen. Low estrogen is bad for the heart. Well, it depends on your starting point, right? If a guy has stupid high levels of estrogen and we're using the AI to get him into a really good optimal place, that's good for the heart, right? But the endothelia in your arterial walls, they need estrogen. They need it at good levels. So no. But if you take it chronically and you don't need it and you're driving your estrogen levels down to like a super, super low level, yeah, that's not good for your heart. That's not good for your endothelia. And it's not good for like every other system in the body either. Estrogen is critical for most guys to feel as well as they possibly can. Joe says he breaks his dose down into 3 times a week. That's great. That's great. Spartacus, 25 milligrams of DHEA a day on TRT. DHEA is definitely part of the, the androgen cascade, obviously, right? But this is what blows my mind. We used to prescribe DHEA. And then after some training with some of the best guys literally in the world, we pulled it because there's no research that shows supplementing DHEA has any positive clinical outcomes. So it's just more money that we end up wasting on our patients. Now, some guys swear by it. They swear by like the penile and scrotal application of DHEA daily in helping erection quality. I haven't seen a study on that. I don't think there is one. I haven't tried it personally. I don't know. But aside from that, that might be an outlier because there's a lot of anecdotal evidence to support that works. Again, anecdotal, it's not real research, but the real research shows that DHEA doesn't do much is when you're supplementing it. Okay, so not sure if that helps. Orchid, 65, survived 5 blood clots from long-term HRT. I want to get off the Xarelto. That's tough, man. So testosterone can cause an increase in some clotting factors a little bit, just a little bit, right? Not much. But the red blood cell count is where a lot of guys go, oh, it's gonna increase hematocrit. I'm gonna throw a clot. Well, red blood cells themselves don't clot, right? Platelets clot and clotting factors clot, but red blood cells definitely they get caught up in the clots, right? And they make the clots bigger and worse. So increased hematocrit can exacerbate that. Orchid, my only thing I would say, getting off of any pharmaceutical drug is always a good approach. I like where your head's at, but what are we sacrificing, right? If we get off the Xarelto by getting off the testosterone, and now we're kind of introduced to all these chronic diseases that run parallel with low T. You might be introducing more than you're eliminating, but that's an individual assessment. Talk to yourself, your doctor, talk to us if you want to, but don't make an emotional decision to get off of one thing to be healthier. And then you don't want to run away from like a baby bear towards the mama bear. You know what I mean? We want to make sure we're keeping our, our risk assessment as clean as can be in our decision making. So. All right, Tom God Ali, it does work, man. There's some really good stuff. Huberman talks about it in a couple of his podcasts. The differences are marginal, right? It's not going to be like life-changing for you, but adding it to a regimen of a bunch of other things that you do, you can stack a lot of 1%, man, and make big change in your life. So, do we treat in Alabama? Yes, sir. Hit us up. We're happy to take care of you. Luis Corona says he's taking 100 milligrams each 7 days. Is that good enough to maintain normal test? It's a great dose for a lot of people. Split it in half. Do it every 3 to 4 days. It'll be a little more even for you, but that's definitely plenty of testosterone for a lot of guys. Kirk, do you think that pinning every day can lower estrogen levels? No, there's literally no research to support this. What creates estrogen is serum levels of testosterone, right? Now, if you pin daily, you're going to be super level, right? If you do every week, you're going to be doing all of this, right? But it's going to average the same. It always averages the same. And so the average is going to be the average amount of estrogen produced from X amount of testosterone. Doesn't matter on application at all. And also subcutaneous versus intramuscular doesn't matter. You'll see some people talk about that. But your average serum level of testosterone will turn into X amount of estrogen, and that's going to be your week. Now, if you pin weekly, you're going to go up and down in estrogen production, right? There will be days where you're much higher with estrogen, and there will be days where you're much lower, but the mean is going to be the mean, and it's going to work out. And so, are we looking at getting licensed in PA? We're not, but I have a colleague in PA. So shoot us an email, man, and we're happy to make an introduction to you. Is the high testosterone donated blood good for the person it may go to, or does it affect it? I doubt it makes much difference, man. You're talking about a pint, and there can't be that much testosterone in that at the moment. So, is the anti-estrogen absolutely necessary? I've read it can be dangerous to crash estrogen. Jeff, you're exactly right. crashing estrogen is terrible, right? Some guys need it to get way too much estrogen into an intelligent level. And if that's the case, it's you need it, but most guys don't need it at all. Most guys can carry a boatload of estrogen and not have any side effects. If that's the case, don't ever treat the number. Like if you're getting testosterone and it says your estrogen is a 55, right? So high, it's registering high. Don't let that be the impetus for treatment, right? Ask yourself, do I have estrogenic symptoms? Am I retaining water? Am I emotional? Like, am I just all over the place emotionally? Am I having nipple sensitivity? And if the answer is no, you can handle the estrogen, right? And you want to be able to handle as much as you can handle. And so don't treat anything unless you're having side effects. And if you're having side effects of too much estrogen, then treat it. That means your body's literally telling you, I have too much, so let's do something about it. But again, don't hit it with a huge hammer. Like just get yourself right back down into an optimal level. Don't drive it all the way down to nothing. What are the studies on elderly dying early on testosterone? There are none, right? There's a VA study on cardiovascular events. It's fantastic. You can just Google like testosterone study VA. 86,000 men were in the total cohort. They were split into 3 groups. One was a non-medicated group. One was a poorly medicated group, which they were on some testosterone sometimes, but it didn't meet decent qualification criteria. And then there was a well-medicated group, and the qualifications for the well-medicated group were terrible, but they were still getting testosterone routinely. Like a good clinic takes way better care of you than what that qualification criteria was, but it showed the well-medicated group had half of the cardiovascular events and were half as likely to have died in the 14-year observation period. Okay, that's a big study, right? It wasn't like 8 people in a study. It was 86,000 men, right? So that's a big study. There are others. We could talk about those all day, but there are no studies that show people die early on testosterone, not all. Donating every 2 months, too long or too soon? Is the goal to be in the low 50s or 40s? Good question, man. And this is just very, very dependent on the person, right? So the Red Cross sets a 56-day routine limit for a reason. If you give blood too much, you bomb your ferritin levels and your iron levels, and you'll create an anemic situation. So we don't want to do that. But I shoot for low 50s for me, right? I stay at about 51, 52, something like that. I believe in giving blood. I give blood often for that reason, but my numbers being at the low 50s, I'm fine, right? Everybody's fine at low 50s. So don't shoot for the 40s, because the more hematocrit you have, the more red blood you carry, right? The more oxygen and nutrition you carry, the higher your VO2 max, the better your recovery. You don't want to bottom that out too much, and you don't want to deplete your iron stores, because you just can't carry oxygen without iron, right? So that's what you want to keep in mind, with these blood donations. Fasting for 72 hours, it raises your HGH levels by 400%. The research on this is atrocious. It is atrocious, right? That's just not true. And if it were true, it would go against everything that fasting does, right? Fasting causes us to lose lean muscle, right? And I'm not anti-fasting, but we understand the nutritional side of the house here pretty well. It's pretty good for your gut, but everybody wants to talk about autophagy, and we want to kill those senescent cells, right, through apoptotic signaling, and we do that by inducing that whole process through fasting. Well, the same thing is induced in a calorie deficit, right? And the problem with fasting is, you get the autophagy in a short window, because you can't stay fasted very long, or you'll wreck your body, right? You'll wreck your metabolism, your hunger hormones go crazy, ghrelin spikes, leptin goes away, your thyroid suppresses, you start, catabolizing lean muscle. There's all these issues, but people do it for the autophagy. Well, just stay in a mild, reasonable calorie deficit, right? That also induces autophagy. Also go after those senescent cells that don't really respond to the apoptotic signaling. And you can do it forever, right? You can stay in a very, very mild calorie deficit for very long periods of time without affecting your metabolism and your lean muscle. Now, sure as hell makes it harder to gain muscle in that situation, but it's a pretty good, if you can find your maintenance level, right, and just stay right there, just a little bit negative into that maintenance level. Again, hard to gain muscle, but you'll still achieve all the things that you want to achieve through fasting in a much more reasonable and in a much more sustainable manner. So, Marriage and kids are two of the biggest reasons for test reduction. Single and no kids. Well, that's hard to argue with. But I tell you, man, we are seeing such alarming numbers of lower and lower testosterone levels in 20-year-olds, 20-something-year-olds. It's terrible. It's frightening, man. So definitely the more stress you have in your life, the more everything is going to be crazy, right? And wives and kids and husbands are big sources of stress. But yeah, it's not just that, unfortunately. Optimal weekly test injection amount. It depends, man. We have guys on 100, 150, 200. We have some guys on a little more, some guys on a little less. We custom curate the plan to the individual and assess very heavily and figure out where that guy feels the best. And also where things start to fall apart, right? Like, so if a guy is spending way too much estrogen, well, he might have too much testosterone, now, not always, but there's a lot of factors involved. But our biggest primary factor is where do you feel great? And we stop there, and then that's that guy's level. So can Butrin impact a guy? Absolutely. Butrin is a powerful drug, man, and it really gets between the ears. I mean, that's its whole point, right? But it really negatively impacts a lot of people. It'll just suck the soul out of a lot of people. So, Butrin takes a while to get a baseline, and it takes some tweaking. So you don't want to try it for like a week and give up on it. It can take like 6-8 weeks to really truly get set right on Butrin. But yeah, man, it's a bitch for a lot of guys, for sure. If you've been on it for a couple months, you're not getting the results you want, definitely talk to your prescriber on that and try something else, for sure. Women also need, absolutely. What is your name here? It is One-Eyed Willie. Yes, we treat a boatload of women with testosterone. We actually keep women between 150 and 250. That's a big dose. And because women do need it big time. And something that is amazing, there was a study that came out 2 years ago by a company called BioT. And again, I don't ever quote a study that has like 20 people in it. That's BS, right? That doesn't mean anything. BioT did a study on 100,000 women that were on testosterone that were kept between 150 and 250. And during the observation period of this study, they had 1/2 of the breast cancer incidences that women that weren't treated with this is. And we're seeing this now on the prostate side too. Men that have super high levels of testosterone have much, much lower incidence rates of prostate cancer. There's something, and they don't know the mechanism, right? But there's something that's cancer preventative by high levels of testosterone. It's not perfect. I said half the incidence, but man, if you can reduce breast cancer from like 1 out of 7, 1 out of 8, to like 1 out of 15, how many lives are saved? How many lives are changed with that? That's beautiful. So yeah, that is, we throw testosterone at women that need it just as fast as we will a man. Probiotic. I'm huge on that, man. Every single day I make a shake and I use kefir as a base, and I put a probiotic super green in it, and I put a fiber component, like a 5-point soluble fiber component in it. I am huge on gut health. More neurotransmitters are created in the gut than the brain. They've proven that recently. And yeah, absolutely, man. Your gut also is where 20% of your thyroid is converted from T4 to T3. That's by far the most metabolic hormone in the body. And so there's all sorts of reasons you need to take care of your gut. Big time. Kevin, are DHEA supplements safe? They are. They don't do much according to most research, but they're safe. Yes. All right, Spartacus, been on TRT for 2 months, still has ED. Happens all the time, man. ED happens because of a lot of reasons, right? It can be vascular, it can be a trauma event, right? Something like Peyronie's disease. It can be an endocrine issue. It can be testosterone for some people, but it's definitely not for other people. It can be a nitrate production issue for a lot of people. It can be, there's a ton of psychological issues that have to do with it. It could be neurological. There's a lot of things, right? So a good ED workup is important. Now, I will say this, regardless of what the issue is, there's a fundamental like hydraulic issue with ED, right? So you have arteries that run through the middle of each of the muscles in the penis. They fill up the penis with blood when your body gets aroused, right? It starts with oxytocin, and there's a couple other hormones that come out. Nitric oxide is produced. That starts the process. The long muscle in the penis begins to relax as the blood gets brought in, and there's a couple valves in the top part of the penis that kind of shut to keep the penis erect, full of blood. All right. So two things are going on, right? There's hydraulic pressure coming in, right, to get it, and also you have to keep it, right? These valves have to stay shut. And so if you're having a trouble with the supply, it's an arterial issue, right? It's a blood supply issue. If you're having plenty of blood coming in, but you can't keep it in, then it's a venous leak problem. The valve issue is the issue. And again, so many reasons for this. But our biggest home run for this is daily use Cialis. It just is a cheat code. It's the most cost effective and highly probable to fix the issue that we have, right? And also the daily use is so much better than the 20 milligram because the 20 milligram, you have to time it right? You take it a few hours before you have sex, but you got to carry the pill around, and a lot of guys will take it and they end up not having sex that night. And the 20 milligram dose gives you a lot of side effects, right? It wrecks some guys, migraines, backaches, like reflux. It messes with your vision and all these things because it's such a big rush of vasodilation because it's such a big dose. The daily use, you can trickle it in slowly. You can't do this with Viagra or Levitra or anything because they only last like 4 hours. Well, Cialis lasts like 72 hours in the body. So you can do little bitty stair-step doses, get up to a really good serum level, and you never really introduce that monster rush of vasodilation all at once. That's a big deal, right? You want to be able to get the erection when you need it without having to time the pill. But the beauty of this is when you have that constant level in your body, your nighttime and morning erection frequency skyrockets, right? And so you're getting a more therapeutic benefit from this because you're getting hundreds of erections in a month that you wouldn't have gotten otherwise. And at the end of the day, man, like all tissue function in the body operates under one construct, and that is if you don't use it, you lose it, right? And so you want to use this as much as possible, right? So the daily use Cialis makes you have a ton of erections. That helps, right? So give that a shot, man. It's cheap. You can get it anywhere. If you can't find it, let us know. We can help you out with that. But yeah, testosterone is not a panacea, like always a fix for ED at all. Soriano says he takes 5 mLs once a week of cypionate. I hope you got your math wrong on that, bro. That is an ass load of testosterone. Please don't take that much testosterone. Are SHBG levels more important than testosterone levels? That's a great question. SHBG is a enzyme in the body that grabs testosterone and locks it away. Only two things do this in the body. Albumin does it and SHBG does it. Let's say your total testosterone is 1,000. I don't care. It doesn't matter what your total testosterone is. The only thing that matters to me is what your free T is, because we'll see some guys with a total testosterone of 1,000 and their free T will be a 6, which is terribly low, right? That's low T. Even though he's got 1,000, right? His overall number looks good. It doesn't matter. You can't get to it. It's unbioavailable. It's locked away. It can't go upstream, or go downstream. It can't, like aromatase or 5-alpha reductase can't touch it. It can't stimulate kidney, to make the erythropoietin. It can't do anything. It's just locked away, right? So in that regard, your free T number is what matters more than your total number. Now your SHBG will definitely affect that ratio. And another thing on the flip side of this, we get guys in here all the time. They'll be like a 450 total, right? But their free T is a 20. They have great testosterone levels, right? That 20 is fantastic. We medicate guys up to that 20 many times. And even though his total is low, that guy has all the testosterone he needs. We can't put him on testosterone, so the SHBG number is the reason for these ratio mismatches, but we don't ever try to treat SHBG issues because it's like chasing a cat around a room. They change all the time. Your diet affects it so many ways. The only way to do it are using some drugs that we don't really legally have access to, so we don't want to do that. And I'm not going to ask a guy to make huge dietary changes for short-term reflections in that SHBG, because the SHBG will typically return to normal, number one. And if they eat the way they want to for a while, well, that'll return to normal. I would rather just give the guy more testosterone. Get that at a level, steady, predictable, normal state where he has optimal levels of free testosterone, and then the SHBG doesn't matter. So chasing, we used to do all this all the time, man. We have these SHBG management like protocols. chasing cats around a room is a nightmare. So hope that answers your question. Self-prescribed TRT due to primary physician's pushback. Man, we see this all the time. I hate that. How does that work for clinic onboarding? We take guys off of shit on the street, bad protocols from doctors, good protocols from doctor. We take guys off of other TRT clinic protocols because they're just not getting the love that they want from that clinic. And we know how to transition you onto our program regardless of what your situation is. So just be honest with us, make sure that what you're telling us reflects in the blood work. And if it all makes sense, we'll make whatever necessary changes we have all the time. We don't mind that whatsoever. Mongol, got nothing out of Tongat Ali. Yeah, unfortunately, that's going to typically be the experience with almost all supplements. So it doesn't surprise me. Best place for a TRT shot? Good question, Spartacus. That's wherever you prefer. Like some people, we use 27 gauge half-inch needles primarily. Adipose tissues, fine. Belly fat, glute, thigh, shoulder. We don't care, man. As long as you get it under the skin, it's all going to be absorbed at the same rate. It doesn't matter if it sits in adipose tissue or muscle. So whatever feels, the easiest to you is the way to do it. All right, is letrozole better than anastrozole? One better than the other or the same? Nope. The issue with all of these, don't use them unless you really need them. And if you need them, start with as low a dose as you can and titrate up until the side effects that you are trying to mitigate go away. And then stay there, right? So as little as possible, with none being the preferential number. And letrozole is fine, yeah. Can fasting drop your blood sugar, which in turn raise blood pressure? No. Dehydration can do this a little bit. So if you're fasting and you're not dehydrating, but just a blood sugar drop, and this is in a healthy person, right? You don't want to be playing with these if you're a severe diabetic or if you have some like ketoacidosis issues that could pop up. But no, I'm not the biggest proponent of fasting, and I don't like things that aren't sustainable. You know what I mean? I like sustainability. I like predictability. If I can achieve the same things through just a moderate, intelligent calorie deficit for a week or two that I can like some kind of hard fast. I have a healthy gut. I'm not worried about that. So for me, it's just not, we don't recommend it for our patients. It's just a little too extreme and it causes problems. The failure rate's high. I don't like to introduce anything that has a high likelihood of failure because failure can snowball, it's in people's minds. So it's not the biggest fan. When someone's dialed in, how likely are they to need a dose change year to year? Man, that is a fantastic question. I don't think I've ever been asked that question. Wow. For guys, man, it's typically set it and forget it. For women, perimenopause is called the change, right? The change. So if you get them early, you get them set right, they're like, oh my God, I feel amazing. Their body's still changing, right? Their hormones are still changing big time. So women will need adjustments over time. Most men, though, you get him set. Let's say he's got like chronically low testosterone at 30 years old, and we get him at a good level for him. That number is probably going to support him for the rest of his life. So apples and oranges depending on the sex. Can I get away with a smaller 1-inch needle, 25? Yeah, absolutely, man. You can do whatever you want. If that's a preference for you, by all means. Most guys like the smaller needles, so the only issue with the smaller needles, it takes a little bit longer to draw up. The 27 gauge does draw it up, and we're only pulling up half of an ml at a time, so that's, it's not that bad. Are we able to help in Idaho? No, but a good friend of mine owns Idaho Health and Hormones. She is as smart as she is beautiful. Hit her up, she'll take care of it. And she's a badass. She's a bow hunter, elk hunter. She hunts elk with a bow. Like, she's a bad bitch. So holler at her. She'll take loving care of you. All right, how to start a treatment with us, man. Just go to lowtenation.com. It's the easiest way. Shoot us a message through our contact form, and we'll get back with you guys ASAP. We have an amazing intake team. We have an amazing intake process. It only costs $100 to get started with us. That's the lab work. We actually lose a few dollars on it. We don't make any money on it. You get a free consultation. We'll tell you what we see and what we recommend. If you want to get going with us, you can. We don't have any contracts or obligations. It's all month to month. So we make it a no-brainer, right? I just try to get all the obstacles out of the way, get you feeling better, And if you love us, you love us. If not, just let us know. We make it so easy. And so, what is the best natural way to improve testosterone? This is a good question. I fight like naturopaths on this all the time. I'm like, show me one study that shows anything that boosts natural testosterone. There's not, right? Now I can look at a guy's testosterone level and see if he might have testicular potential, because there's a signal from your brain called luteinizing hormone that goes to your testicles. If that signal is up already, if like you're pushing the pedal on the car already, there's nothing you can do. There's all these things that happen right before this, right? So there's this whole cascade of things that has to happen. There are failure points in that cascade, but if LH is up, that's the last thing in the chain that has to happen for your testicles to make testosterone. At that point, it's a cellular request that can't be fulfilled. Rhonda Patrick has shown, if you guys aren't following Rhonda Patrick, you're messing out. Like, she's the smartest person on the planet. But she has shown that high doses of fish oil can cause a marginal increase in testosterone production predictably. Aside from that, all these boosters and all these other things are garbage, right? And if that LH signal is already up, you can't like just improving lifestyle, getting into the gym, doing squats and deadlifts, and, compound complex. They're not going to do anything. Their job is to like increase that signal when that signal is not being implemented. But unfortunately, yeah, man, there's just no natural way to do it. Your body just naturally does it until it can't. And it, like, again, naturopaths want to fight me. They're like, well, what's the root cause? I'm like, you can't find the root cause in any of this unless it is, complete sedentary lifestyle to the point that LH marker is basically not there. That's different, right? We can address that. But SSRIs, get rid of them. Weed kills your testosterone. Get rid of that. But if you're not doing anything that's hindering it, there's no natural way to increase it. All right, Soriano, 0.5 once a week. Thank God, man. I was like, oh, this bro's gonna kill himself. Yeah, man, 0.5 a week for most people is, if it's of 200, it's gonna be a decent dose. Like you said, we have guys on 100 milligrams a week all the way up to 200. So if that's 0.5 of 200, yeah, again, I like you to take it every, 3 to 4 days instead of every 7, but yeah, man, that's a good dose. Jay says, wait, you're saying I can inject SIP with a 1/2-inch needle, same dose? Absolutely, man. We have like 1,000 people on this protocol and they love it. About 2 years ago, we switched from the bigger 1.5 inch, like 23 gauge needles down to the 27.5 inch, and across the board. I mean, we have some old school guys that still want to inject for whatever reason, but across the board, everybody was like, oh my God, thank you. Those needles, they stress people out. There's a real anxiety from some of those needles after a while. And so, is there any likely long-term side effects of daily use Cialis? Yes, a happy wife. No, man, it's good. So it's on label now, obviously for ED. It's on label for BPH, it's like Flomax, for benign prostatic hypertrophy, and it's on label for hypertension. There's a lot of doctors putting guys on daily use Cialis instead of like 10 to 20 milligrams of lisinopril because they get the same antihypertensive effect, but also they get the bedroom effect. And also it's good for the vascularity of the prostate. So, man, it's a no-brainer, right? You're not going to run into any issues with the Cialis. So, Jay said, want to give us props. Oh, sweet, man. This is what we're here for. We love to help out, man. You guys are amazing to us. We just try to give back a little bit. So yeah. And also, if you guys don't mind, what you guys can do for us, which would be amazing, is just go to some of our videos, like them and share them, show the TikTok algorithm, the Al Gore, if as BioLane says, show us some love for us. We're trying to spread the news, man. Obviously we got a business to run. We're trying to get more clients and make more money, but also we love what we do. And we do what we do because of you guys. We're not here just to make a buck. And not one person in my company is here to make a buck. I can promise you that. We love it, man. And so, yeah, appreciate the kind words. You guys are awesome. And 5 milligrams of Cialis, that's the recommended daily dose. We're somewhere between 5 and 6. We have some guys that need up to 10 a day, but 5 is really good. Cialis made DJ's eyes water all day. There are some guys that just don't tolerate it. Unfortunately, it sucks. But yeah, it does happen. At what dose Cialis for high blood pressure. No, 5 milligrams. The doses that are on label, right, for the daily use doses that are on label for ED, BPH, and for hypertension are 5 milligram doses. Crying watching a commercial, normal, or could that be estrogen? Well, it depends on the commercial, right? There's some sad ass commercials out there. The commercials that have the hungry kids, man, I start crying to those things all the time. But probably estrogen. Get a blood test. Also make sure you don't have any nipple sensitivity. Also make sure like where you wear your watch or your socks, if you see more banding, if you see more like imprints from your socks and your watch, you might be retaining a little bit more water. All of those are good indicators that it's estrogen. But yeah, guys tell us that all the time. Like, man, I'm crying like for no reason. What the hell? And we get them in the lab and their estrogen will be like 100 or something like that. So yeah, it definitely could be that. So one more thing on the Cialis issue, or on the Cialis point, we have something. So at low dose, let me be very, very clear here. Low dose SSRIs are phenomenal for guys with premature ejaculation issues, right? So we have a Cialis now that has something in it that will, and it's super subclinically diagnosed, right? So you're not going to feel like zombied out. You're not going to feel like you just took a Lexapro and you can't really focus on anything. But the daily use Cialis troches we have that have the SSRI component, again, super lightweight SSRI component, that's a godsend for guys that are having trouble, climaxing way too fast. It can extend their bedroom function by 20, 30 minutes, literally just by taking the pill. So I love offering that out to our guys too. We've got some TikToks coming out on that. So guys, I got to get out of here, man. Dude, a testosterone, or excuse me, an estrogen level of 260s, I've never seen that be okay with anybody. Like, I can keep mine over 100 and I'm fine. I don't typically, but I can. But yeah, that's going to be problematic for everybody. I mean, you're going to grow breast tissue at that level, seriously. And so letrozole 2.5, it crashed my estrogen. How long to wait to test again? So it takes a minute. So letrozole and anastrozole work on different mechanisms. It takes a minute to rebound longer with the letrozole. But once you've waited, 3 or 4 weeks after the cessation of the letrozole, you'll be good to go, man. And so, gentlemen, it's been a pleasure. Ladies, thank you so much. I appreciate the fantastic questions. We're going to save this, pop it out on YouTube. So if you guys ever have any comments, throw them out there. If we can help you guys, please don't hesitate. Hit us up at Low T Nation. We'll gladly reach back out to you. We're licensed in about 9 states right now, but we have affiliates. And by affiliates, I just mean, we have relationships with other clinics in all 50 states. We're happy to connect you with somebody that we've vetted personally, by the way. We'll connect you with somebody that'll take good care of you. So you guys have a great one. Thank you, guys. See you.